Newswise.
So transverse myelitis is an immune disease of the central nervous system. It can sometimes occur in isolation. It can also occur as a component of multiple sclerosis and some of the other related immune diseases, NMO spectrum disorders and anti-MOG disease. So transverse myelitis is something that we're very familiar with in this field. The second point I would make is that immune complications of vaccines is one of the things that we watch for. It sort of underscores why vaccine development has to be very systematic and very careful. So I think beyond that, most of us don't know much more about that. The one patient that had the transverse myelitis adverse effect compared to the rest of the public. So, but I think we're very interested in learning more about that one. I don't know if Ben or Bernard want to comment further on that.
Maybe sure. I can comment on it. I mean, there have been studies in the past looking at the risk, how much the risk goes up after vaccination. And currently our understanding is that vaccination is not a risk factor to develop multiple sclerosis. Of course, the situation might be very different for the COVID vaccinations, but so far, when you look at the relation of vaccine and the development of MS, there is not a real case. So as Jeff pointed out, I think we need to look in this one particular case. What actually happened there is that transverse myelitis, or is that MS, and whether it's a unique and single event, or whether this is a real complication that occurs in more patients. And I think we need more information on that. Of course, it is a concern always when you do something to the immune system, it might cause some misdirected or wrong responses that could also target self-antigens and lead to an autoimmune process.
Yeah, I would echo that. And also, just to elaborate on it, there are instances where there's, MS is believed to be an autoimmune disease, and there are instances where autoimmune diseases of the central nervous system have been associated with vaccines, for example, Guillain-Barré syndrome and influenza vaccine. So it is possible there's this concept of molecular mimicry, that when you stimulate an immune response against a virus or some other pathogen, there can be an overlapping response to a protein in the nervous system. And that's possible here, but I agree it's a matter of speculation at this point.